Do y'all believe that? I don't believe that for a second.
No, I really don't know. I just turned around and I started laughing.
Did you have a thought? What?
I think.
Too much candy.
Are you on nitrous or something? Because like I did that when I was on nitrous. Like I was like that, like belly laughing, and they were like, "Are you okay?" "Yeah, I'm great." All I could think was watch him try to pull my tooth now. All right. So let's talk about patients under the influence. Speaking of nitrous, they explained that to me. That's like packing or going on vacation. You don't even have to pack for. They weren't kidding. Let me know if you start spinning, and I was just like, okay. And then I started laughing and could not. I mean, like, it was uncontrollable laughing. I couldn't. They were like, "What were you thinking about?" And I was like, "I don't know, nothing. It doesn't even matter. I'm just happy." They go, "Let me turn it down. Wait a minute, hold on." They used to actually have nitrous, right? Nitrous is making its way back into the hospital setting. Yay for me. For some hospitals for labor and delivery, right? It's a great anesthetic because it's self-medicating. You take it all yourself. There's no long-term effects. As soon as you stop breathing it, you breathe oxygen, you're done. You're all good. So you can't overdose on it. They used to have it on ambulances. Did you guys know this? They used to have nitrous oxide on ambulances. Do you know why they don't anymore? They were always leaking. They were always empty.
That's what like Steve-O got hooked on.
Yeah.
He was doing.
From she's like Jack.
Oh.
Yeah, he was really.
He was addicted. He used to go through like I saw a documentary.
He would do.
They did a documentary on the guy from...
Yeah, he like went to, like it was like a bad one.
Yeah, like he had bottles of nitrous.
It's kind of some kind of
He would seriously.
like on your. Well, anything is nothing bad.
Well, right, in excess. Too much water in excess is bad for you. You know, like a liter of saline, salt water, if you drink ocean water, will kill you. It just depends. But the idea is they do it themselves, so when it starts getting too much, they can't even hold the... See, and it just kind of goes back.
It would definitely make the...
I have a huge fear of
the
dentists.
hospital.
I have a huge, like my hands get sweaty. They go, "You need to stop pulling on the arms of the chair. You're going to break it," kind of thing. I have this huge fear of dentists. I told you my kids get extra money because Mama don't have to pull their teeth. Thank God we're almost out of that. They're breaking me.
So is teeth your thing? Because it'd be mine. I've got my teeth.
See, and it freaked me out when I was a kid to have my teeth pulled. So it just kind of depends. You know what I mean? Yeah, I don't. Anyway. All right, under the influence. Okay, so alcohol and or drugs are involved in 50% of all motor vehicle collisions. 50%, guys. That's not talking about, so every Saturday night you're out on the road. That probably changes a little bit. But that doesn't mean that at 8 o'clock on a Wednesday morning you're not subject to coming in contact with another driver under the influence of drugs or alcohol. Okay? And this is probably a big surprise. 50% of all homicides, drugs or alcohol are involved. Anybody surprised by that one? Yeah, no, not too much. Roughly half of all of the adult patients that are trauma victims that you're going to come in contact with are going to be drunk, high, or stoned. Period. Okay? Literally. Don't let their age fool you. I had a 70-year-old woman who wrecked her car because she was... Okay? Well, sure. You develop habits. What makes you think that you don't continue those habits when you get older? Okay? So...
Also don't live that long if they're doing all that.
Moderation. All in moderation. Okay? So, how does this affect us? Yeah. Well, my mental status, pupillary response. How does it affect my vital signs?
Swollen or...
Depends on what I'm on, right? If I'm on cocaine or meth, absolutely everything is like, that's why they call it speed. It speeds everything up. Okay? What is alcohol? It's a depressant. So those people who drink, right? Those college kids have way too much to drink. When they get alcohol toxic, what happens to the respiratory rate? Drops way low. Okay? Your narcotics. Narcotic overdoses. Respiratory rate just drops. You come up on somebody that's breathing 4 times a minute. All from narcotics. Okay? And then, obviously, perception of pain. Right? How many of you guys have seen that guy? How many of you guys are over the age of 21? Okay. So, how many of you guys have been out and you see that guy that gets into a fight and you're thinking, is he really that drunk or is he too stupid to realize that he just got the snot kicked out of him and he doesn't, and you're like, oh my God, dude, are you okay? And he's like, man, I'm good. Where's he at? Like, are you serious? It's that decreased pain sensation, right? Not to mention the obvious judgment impairment that we have. Okay, reaction time, that's why the drunk guy always loses. Okay? Tell me I'm wrong. I see you laughing over there. Am I wrong? Have you been the drunk guy, Will? Okay.
I had a pair of boxing gloves, and my friends would I was kind of an instigator.
Did they each get one? Because that's what they used to do to me and my cousin when we were little. They go, we have one set, you get one, knock the snot out of each other and get it out of your system. That never went well. Are they the big blow up?
Yeah, they were like legit boxing.
Awesome. Awesome. All right. And then they're also going to have a decreased reliability of history. Let me tell you something. Whether it's in law enforcement or in EMS, most everybody you're going to come in contact with, most of them are going to be unintentionally dishonest. Okay? You'll have some that go, hey, sir, someone specific, a name. Hey, sir, have you been drinking? No. Hell yeah, I've been drinking. What you been drinking? Well, I ran out of beer and we switched to mouthwash. And the partner goes, yep, I can smell it. Been drinking mouthwash. Mouthwash is significantly alcohol, if you don't know. Okay? Yes, when people check themselves into drug and alcohol rehab, they can't have things like nail polish remover, mouthwash, none of that, because it's significantly alcohol. Oh yeah, Robitussin. Robitussin's a big one too, right?
That's not. Is that because of the alcohol? That's because of other stuff, though, right?
It's significantly got it's got a high content of alcohol in it.
Or the hand sanitizer.
Yep. Mm-hmm.
I've heard about that.
Yeah, people will drink rum and it's crazy. It's crazy.
Put that on like whatever, if you slide or something, you didn't have any hydrogen peroxide? We would put like the little hand sanitizers that would disinfect like alcohol or whatever. Does that actually work? Like a rat.
I'm not real sure. I mean, I understand what you're telling me.
Rubbing alcohol?
Yeah, I know what you're
If you
saying.
find enough alcohol content in your hand sanitizer, they would use that as like the last resort.
I'm sure it works.
It hurts.
Probably burns. Yeah, I was gonna say it burns a paper cut, man. I'm just saying. But my point is, this decreased reliability history. You're going to go, sir, for most of your patients, have you been drinking this evening? And they are going to traditionally tell you, one of these days you're going to hear it and you're going to laugh, and you're probably going to laugh out loud. Don't do it in the face of your patient. They tell you, I had 2 or 3 beers 2 or 3 hours ago. You will hear that because it doesn't make it sound. Is that what they tell you, Holly, in the ER? Anybody else have any? You work in the ER too, right? Is that what they tell you? Yeah, 2 or 3 beers 2 or 3 hours ago. It's normal to hear that. And you just kind of go, okay, there's at least an empty 12-pack in your car. Okay? So they may not be reliable. And how about forget reliability of alcohol consumption or other activities? Are they a good historian when it comes to anything? How many of you guys have, and I'm going to use intoxication, right? We're going to talk mostly about intoxicated folks because that's probably who we've all, have you come in contact with somebody intoxicated, Devin? I'm picking on you because I know you're not 21. So inevitably, we've all dealt with somebody who is intoxicated. Are they a very good historian? Have you heard them try to tell a story of any kind? Okay? But they can't. And they can't tell you what happened to them. They can't tell you what hurts. They can't tell you what was going on beforehand. It just doesn't make any sense. Okay? So remember, they're poor historians. Okay? And they may kind of be decreased cooperation. Now, some of that is all about your presentation, right? And I'm not talking about whether you're wearing a police officer uniform or an EMS uniform, because they inevitably don't know the difference, okay? But a lot of it is how you approach this person. Hey, I'm just here to help you out. My name's so-and-so, and I'm a paramedic. Now, be cautious, because these people can be kind of volatile, okay? But a lot of times they don't want to cooperate very well, right? For whatever ungodly reason they might have. Okay? Keep that in mind. Your safety comes first. Okay? Very important. Okay? Never assume the patient is just drunk. Okay? Never. All right? And here we go. The EMT or paramedic and EMS providers frequently determine whether the patient is cooperative or uncooperative, and that's that presentation. You'll know this, and I'll tell you why you'll know it. You'll know it because at some point in your career, you're going to respond, and there'll be first responders on scene. And you can already look at the way the first responder is standing and the way the first responder is talking to them, what you are going to deal with for the rest of the time there, right? Same thing with some cops. You'll look at some of the cops and go, holy crap, he's already got this patient mad as can be. And, you know, and some of them you kind of go, okay, it's cool, because he can kind of diffuse things, he can talk them down, you know, this kind of stuff, okay? That's what they're talking about here, is people under the influence tend to be a lot more reactive. So they tend to react to their surroundings, and remember, they may have a twisted sense of their surroundings, but they generally tend to react to their surroundings, okay? So patient interaction. You need to be positive, you need to be non-judgmental. Very important. And you'll hear people, oh, it makes me so angry, talking about, I'm going to give them a big IV, or I'm going to put this tube in your nose. What are you hoping to accomplish? Because first of all, they're intoxicated enough, they won't remember it tomorrow, and all you're doing is making your job harder today. And are you really taking care of them? So let me ask you guys something, and I should probably cover my mic. So let me ask you guys something. Of those of you who've ever been intoxicated in your life, did you not need somebody to take care of you? Let's be honest.
Yes.
Okay? Generally you do. So do they deserve any less from us? Because isn't that what we're doing? We're here to take care of people. Okay? So it's very important to be positive and non-judgmental all around. Okay? Identify yourself, of course. Ask permission to make physical contact. And again, it's that, I'm going to stick my hand out, hey John, my name's Heather. Or hey, what's your name? My name's Heather, I'm a paramedic that's called here to take care of you, right? That's a friendly gesture. If I walk up to that same person and I'm like, what's going on today? My name's Heather, right? Now how is he perceiving me? How is this interaction going to progress or degress? Very defensive. Very, very defensive. Okay? Orientate and reorientate as needed. Now sometimes at 3 o'clock in the morning when you haven't had any sleep, that's kind of a hard thing to do. Who are you? What are you taking me for? Da 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 da. Hey, remember my name's Heather. I'm a paramedic. I'm just taking you to the hospital. You know, you kind of fell down, hit your head. We're just going to go make sure you're okay. All right? And they will ask the same questions. Now, to complicate things, what happens to somebody with a head injury? Nope. I'm talking straight head injury. What is a potential that you're going to run into? Disorientation. So, was this with you guys the other day that I had a head injury and I was playing one of your patients and I kept asking you the same thing over and over? And you finally kind of said, oh, she has a head injury. Yeah. Where are we at? Yeah, it was you, right, Shaver? Or your group? So, at what point do I know they're just drunk versus they might have a head injury?
Like very short term amnesia, maybe?
Sure. And some of it depends on the extent of the head injury.
Or they're
So,
confused.
yeah. So my point is, you can't determine that that's not from a medical bleed in their head somewhere without further evaluation. Please remember that. Okay? Address them with respect. Okay? Inevitably, if you are disrespectful, you will be treated disrespectfully. Okay? Sometimes even when you're respectful, you're going to be treated disrespectfully. You have to remember this is not personal. Okay? It isn't. All right? And then avoid terms like bud or honey. All right? I'll show you honey. Okay? That's been one of you in this class, or I would guarantee it at some point in time. Right? I'm not your honey. Who are you talking to like that? Right? Bud, you're not my friend. You know, we aren't friends. Who are you? Kind of thing. So, respect. Okay? Consider your body language and your voice tone. Now, I'm not telling you that there isn't a time for tone. But that's only, you know, hey, here we go. Now, as they escalate, it may kind of be a, hey, hold on a minute. I wasn't talking to you like that. There's no need for you to talk to me like that, and we're going to get along just fine. Okay? Remember, you're a caregiver, not a cop. Very important. Okay? Acknowledge the patient's concerns and feelings. That doesn't mean play into it. You know, I beat him up, or, you know, how many of you guys have seen a crying drunk? Okay? It happens on a lot of different drugs, but it does happen. So that doesn't mean you kind of play into that. Just, oh, I understand how you feel. You know, kind of thing. Okay? Acknowledgement. Okay? And then be very clear about what you need and what you expect the patient to do. Okay? And that's all I'm going to say about that. History taking may require closed-ended, i.e. yes or no answers, or yes or no questions, okay? Where at other times, we want to ask them questions that's going to get more information, okay? That may not be necessary or beneficial for you in cases with patients under the influence. And please remember, I use alcohol a lot whenever we talk about this, but that's only because most of us can associate it with, you know, how many of you guys have come in contact with somebody under the influence of cocaine, methamphetamine, K2, K7, marijuana? If 50% of the people that we treat involved in a trauma, I'm going to guess you may just not have known it. Okay? But most of you guys can relate to alcohol. You kind of understand. It can be the same for any of the drugs that you're going to face or any of the influences. Okay? Discreetly confirm history with family, friends, and bystanders. Make sure you know who's giving you the information. Don't ask inappropriate personal questions. But it is okay if you really know, I know Javier's on something. And I may kind of go, he's been hanging out with John, I may kind of go, hey John, I need you to be honest with me because this is about Javier and his life, which y'all been doing tonight. I'm not the cops, I'm not here to get you in trouble. But it's real important that I know this so that I can take care of him the way I need to. Okay? This isn't, and I don't use terms like illegal drugs. Did you do any drugs tonight? What do you think people are going to say to that? Sometimes they'll tell you yes. But I use the term recreational, right? People who smoke marijuana, smoke weed. Do you think they think it's illegal, or it's just a hobby, right? I see you shaking your head. It's just a hobby. Yeah. So it's all about your terminology and how you put it. Okay? Pre-planned management protocols with law enforcement agencies. You may not always agree with their tactics. Okay? And sometimes you go, crap, you're making it worse for me. Right? Sir?
Real quick, back to the other one. If they do tell you they have, you can't tell the police, right? They need a subpoena.
They can subpoena your records.
That's fine. So don't tell them. If they ask.
There are times I may go, hey, officer, do you need to ask him any questions while I got him in the back of the truck? Right? Anybody here ever been pulled over for a DUI? Where are you at in your law enforcement training, John?
Just finished my associates.
Field sobriety test. One of the things that they do a lot of times, put you in their car. You know why? I bet it was hot in the car, wasn't it?
See how long you walk.
Not only that, but what happens when you turn up the heat and you sweat? What does it smell like when you've been drinking? Right? So, yes and no, and is it pertinent, and am I here to get anybody in trouble? No. If I see something that may be considered unsafe in the scene, like stuff in the ashtray, I may kind of go, did you check out that house in there at all? Right? They know. Okay. Remember that the population is at high risk for hepatitis, both B and C, and HIV, right? Don't assume that they have any of those diseases, but just be aware that there's a high potential for that, okay? Again, the patient is never just drunk, right? And you'll see this a lot. You'll get law enforcement who will call you to the scene of their of where they're at. They'll call you to the scene and kind of go, hey, look, I pulled them over because for failure to maintain, which is what? Swerving on the road, failure to maintain single lane traffic. Okay? They'll pull them over, and then they'll talk to them, and they'll go, they're slurred speech, but they tell me they're maybe diabetic. Cops don't know. They can't assess it. They know diabetics can present with low blood sugar like they're drunk or intoxicated. So maybe they go just kind of check them out, and if they're good, then they're going to jail with me. Right? May be the case. I've heard them go, you have a choice. You go with them in the ambulance to the hospital, or you come with me in my car to jail. Well, that's kind of a no-brainer. I guess that depends on who's paying your hospital bill, but inevitably. Okay? And then err on the side of caution with intoxicated patients. What also happens, say in the event of alcohol, what happens to my blood with alcohol? Yeah, so I may be at higher risk for things like bleeding, right? Well, what happens with cocaine? What happens to my heart rate? Speeds up. So what's going to happen to my bleeding? It's going to be a little faster, okay? So you have to consider not only how do I deal with these patients, what are some of the things that they may be dealing with physiologically that are going to affect their presentation with me, right? Somebody who's on cocaine, methamphetamine, how do you know that they're in shock?
Like the way they look. I mean, they still
Have you seen very many people that are real high?
No, but I mean,
It's in Colorado.
you can't like, your body can't lie about not having enough. I mean, your vitals might be a little different, but as far as like if your body's perfusing,
Don't
I
they
wouldn't
sweat
do
though,
that.
and don't they? Yeah.
So they may be a little sweaty, depending on what they're doing.
They're in shock.
No, if they're
If
fine.
they-
I know they.
Right.
I thought your question was how can you tell if they're in shock?
What I'm saying is,
Well, it would be hard to determine the shock, right? Because
yes,
they're already-
even with their perfusion, because if they're sweaty, is it clammy or is it sweaty because of the drugs? Right? What are they on? So there's a lot of things. It may be very difficult. So how do I know? High index of suspicion based on the mechanisms, right? What's kind of going on? What's my patient presentation? And again, err on the side of assuming that this patient is significantly injured, okay?
If they're really high and you know they're high, do you just rule out any type of shock? Or do you still treat it as a shock?
I would treat their signs and symptoms and then kind of look at their mechanism, right? So, and also I have to kind of play into this, how do my interactions play in, right? So if I have somebody really high that was involved in an MBC, do you think I'm going to get an IV on them? Maybe not. So that may be the patient that I kind of go, we just need to go and I need to monitor them really closely, and really transport is important, right? Because let me tell you something, even if the the traumatic event didn't cause them issues, the drugs in their system themselves can cause significant issue, right? So I mean,
Yeah, you're talking about like seeing people with a respiration like four breaths per minute.
oh yeah, they're knocked
And-
out
and-
completely.
And they were talking about, they had like this documentary on this Oxycontin or whatever, it lowers their respiratory rate to nothing.
Yeah.
I mean, they could be practically just about.
That's why we give them Narcan, and we don't. And you know, to answer some of your questions, like Narcan is a drug that paramedics use and ERs use and whatnot to displace narcotics. It displaces the narcotic receptors, basically. It takes the narcotic off of the receptors and kind of binds with that, right? So here's what we do. If I know somebody has had an overdose on a narcotic, morphine or Oxycontin or oxycodone, whatever the case may be, right? If they're maintaining their airway, breathing, circulation, and they're not fighting me, I'm good with that, right? So I only give them those medication. That medication if they're unable to maintain their airway or they're not breathing fast enough, and I give them just enough to kind of get them up in normals, right? You don't want to withdraw them. You don't want to cause them to go. So, I mean, there's a lot of things that you got to consider, right? You push 2 milligrams of Narcan on somebody who's got overdose, who is on a lot of OxyContin, and not only did you wake them up and now you're getting your butt whooped in the back of the ambulance and you're fighting anybody and everybody, but you also cause them more medical problems because you cause them to go into withdrawal. So, I mean, there's a lot to it. Again, remember your head injury, right? Now that you guys know the behaviors of a head injury patient, how is that different than some of the intoxicated patients that you've run across in your life? How do you differentiate? Never assume they're just drunk. You need to assume that they have an underlying medical issue. Okay? Any other questions? No?